In Europe, there are about 500,000 survivors of childhood, adolescent, and young adult cancer. And thanks to advances in medical treatment, more young people are surviving than ever before. But the journey doesn't end with remission. Many survivors face long-term challenges that are not limited to physical health, like mental well-being, education, career development, and navigating complex and often inequitable healthcare systems. To address these challenges, we launched EU-CAYAS-NET, the European Network of Youth Cancer Survivors. Supported by the EU4Health program, this cross-border initiative brings together patients, patient advocates, survivors, researchers, healthcare professionals, and policymakers. Our mission is to improve the quality of life of child, adolescent, and young adult cancer survivors by promoting collaboration, co-creation, and knowledge exchange. At the heart of EU-CAYAS-NET are our project ambassadors, young cancer survivors who share their experiences, shape research, and advocate for change across Europe. They play a key role in raising awareness, engaging in national and international events, and contributing to policy discussions. The EU-CAYAS-NET has been lucky to work with 55 ambassadors from 29 countries. The EU-CAYAS-NET website, www.beatcancer.eu, serves as a comprehensive hub for information and resources for young cancer patients and survivors across Europe. The site offers educational materials and project information, provides best practices and policy developments, and shares tools for young survivors and advocates.
We had almost 1.5 million users on our website. We already have 60,000 visits per month, approximately. We have 1.9 thousand per day organic visits. We have 411 terms related to cancer or healthcare that are useful for people to know. All of them are translated into 9 languages, so we basically have 3,700 glossary terms. We share 107 events on the website. We have 572 original resources on cancer. All of them are translated to 9 European languages. We have 100 original book entries that were created lists and approved by cancer and our ambassadors, by cancer survivors and our ambassadors.
The EU-CAYAS-NET Discord community is an interactive platform for real-time connection, conversations, sharing, and support. The Discord community offers topic-specific discussions, opportunities for local connection, and online community events. It is a safe space to connect, share experiences, and find support. We believe that all young people affected by cancer deserve holistic, person-centered support. To move closer to making this a reality, the EU-CAYAS-NET project implemented 6 activities, or thematic areas. These 6 thematic areas are brought into action through the work of the project ambassadors and the website and Discord community. Mental health is one of the most overlooked and misunderstood aspects of cancer survivorship. Survivors report unmet needs in areas such as anxiety, fatigue, financial stress, relationships, and neuropsychological challenges. Many survivors felt that psychosocial late effects were not adequately addressed in their long-term follow-up care.
Unfortunately, many challenges regarding psychosocial care. But one of the most urgent challenge, I would say, is that there is still insufficient knowledge, education, and above all, I would say, communication about psychosocial late effects. And this is really what we found in our survey, but also in consensus groups and focus groups workshops.
We responded to these needs by developing pocket cards covering key topics, educational videos and webinars, and a new European standard for mental health and psychosocial care. Many survivors face disruptions in their education and career development. These challenges can force survivors to change career paths or experience workplace discrimination. EU-CAYAS-NET aims to reduce educational and career barriers and empower survivors to approach their educational and professional lives with confidence. To do this, we created educational videos and webinars, a map of best practices for education and career support, a train-the-trainer curriculum for professionals in education and career support, and a report highlighting the challenges faced by young survivors in their education and employment. The shift from child-centered to adult-centered healthcare is a challenging process, and it is essential that this process be approached with care. A well-designed transition process empowers young survivors to manage their health and helps them reach their full potential. Unfortunately, the lack of formal transition programs leaves many young survivors navigating complex healthcare systems alone or without proper guidance. As part of the EU-CAYAS-NET project, we promoted healthcare transitions by developing an evidence-based transition guideline, creating educational videos and webinars, and holding a health policy symposium focusing on healthcare transition. 75% of young cancer survivors experience late effects that require long-term follow-up care. Personalized long-term follow-up care is essential to manage these late effects and improve survivors' quality of life. However, access to adequate long-term follow-up care remains uneven across Europe, with significant differences between countries.
I think we have reached some amazing outcomes with the guidelines, the educational support materials and all other things, and also a lot on long-term follow-up care.
To enhance long-term follow-up care, we developed a set of recommendations for long-term follow-up care, outlined communication recommendations for healthcare providers, created a virtual map of long-term follow-up care facilities in Europe, created webinars and educational videos, developed plain language summaries of important information, held a health policy symposium focusing on long-term follow-up care. Adolescents and young adults with cancer often fall into a gap between pediatric and adult oncology services, facing a fragmented and inconsistent care experience across Europe. Adolescents and young adults, aged between 15 and 39 at the time of diagnosis, experience distinct biological and psychosocial needs. Therefore, there is a need for specialized care for this population. However, access to such care remains highly inequitable. This disparity results in varying care quality, unmet needs, and poor outcomes for young people navigating cancer and life after treatment. To promote standards of care in Europe, we gathered information through peer visits to hospitals, held a virtual roundtable focused on minimum standards of care, wrote a paper outlining minimum standards for specialist adolescent and young adult cancer care units, hosted a virtual webinar, created pocket cards to explain these concepts and promote our work. EDI, which stands for Equity, Diversity, and Inclusion, is essential to ensuring that every child, adolescent, and young adult affected by cancer receives care, support, and representation that reflects their unique experiences and identities. Yet many young cancer survivors from ethnic, sexual, gender, and other underserved or underrepresented groups continue to face barriers, both in accessing adequate health care and in participating in advocacy or research.
So what we did as part of the project is we worked with an amazing group of stakeholders to co-develop a toolkit to do exactly that, equip people with the skills to start having conversations.
Without deliberate action, the needs of these populations risk being overlooked in practice, research, and policy. We promoted EDI in the EU-CAYAS-NET project by writing a position paper on equitable, diverse, and inclusive cancer care in Europe, hosting a webinar series, developing a train-the-trainer toolkit on EDI, holding inclusivity trainings and roundtables, hosting a stakeholder forum. The EU-CAYAS-NET project has marked a significant milestone in redefining cancer survivorship care for children, adolescents, and young adults across Europe. The project has produced a comprehensive set of standards, tools, and policy recommendations aimed at improving not only survival, but quality of life, long-term health outcomes, and social participation for young people living with and beyond cancer. We invite healthcare providers, researchers, advocates, and policymakers to engage with these topics and build on this work so that we can continue to improve care for childhood, adolescent, and young adult cancer patients and survivors together. Join us at www.beatcancer.eu